My duty this morning is to introduce our keynote speaker, our opener. Director Antrell Tyson is the director of the Department of Health and Human Services for the country, for Region 4. And for those of you who don't live and breathe HHS like I did for so many years, Region 4 is in the southeast, and it goes from Mississippi over to Florida, then all the way up into North Carolina and Tennessee. So it's a very large region. And he's going to tell you more about what HHS does, but it is impacting every bit of your life if you are in healthcare. So it's a huge federal agency with vast responsibility, and we are thrilled to have him here with us today. In terms of his background, Director Tyson laid a strong foundation as a public policy professional on Capitol Hill in DC, working for committees and for members of Congress. He helped them with their priorities, which are many of the ones that we're talking about today, including reducing maternal mortality and morbidity, increasing access to affordable health care, and lowering prescription drug costs. And so that background is going to be great for this. And also, most recently, worked in workforce development as the Director of Business Services and Policy for the City of Atlanta. And as we are all facing workforce challenges throughout healthcare, I think that background is also an excellent foundation for this. So without further ado, I will welcome Director Tyson to the stage. Thank you so much.
Thank you, Beth, for that introduction, and good morning, everyone. Come on, we could do better. Now, I know it's a little early, but it's only 8:30. Good morning, everyone. Good morning. All right. Thank you to State of Reform for putting together such a magnificent convening of the who's who from the Florida medical community to discuss the important initiatives impacting Floridians statewide. It is an honor to come before you today as the Regional Director for the United States Department of Health and Human Services. In my role, I'm responsible for engaging regional stakeholders like yourselves to help advance the healthcare priorities of the Biden and Harris administration under the leadership of Secretary Javier Becerra. I was appointed, there we go. Got to make sure that the technology works as well, okay. I was appointed to this role over a year ago, and as you can imagine, we've been extremely busy tackling the very aggressive policy agenda while also adapting to public health emergencies as they arise, from addressing infant formula shortages to slowing the spread of mpox to reaching an to reacting to an ever-changing reproductive health healthcare legal landscape. But during my time, I've also made a few personal observations of my own. Having stepped into a leadership role of a federal department as massive as HHS is. First, I realized that HHS covers a whole lot of policy issues on a regular basis that I had no clue that we did. Secondly, I realized that a lot of our stakeholders didn't realize the scope of our reach as well. But finally, when I realized that many of the people inside of HHS had no clue either, I didn't feel too bad after all. So I say all of that to suggest that before we dig deep into the administration's priorities, that I want to provide a high-level overview of HHS, who we are, what we do, so that you all can get a better understanding of the level of interdepartmental collaboration that's involved in advancing the administration's priorities. So what is HHS? Well, we like to refer to ourselves as the one governmental department that touches every phase of a person's life, from before the time that you were born until the time that you're a Medicare recipient over the age of 65. We are also the second largest department, right behind the Department of Defense, but we're the #1 grant-making department in the entire federal government. We divide the country into four different regions, and we're divided in 4 different regions, and our region is Region 4, which covers the landscape that you see there. So we cover Florida, Georgia, Alabama, Mississippi, Kentucky, Tennessee, and South Carolina and North Carolina. We're the largest by population. We're the largest by the number of states. We have the largest number of Medicaid recipients. And unfortunately, we have the most states that have not expanded Medicaid. And as you'll see, that will be a reoccurring theme today. And most importantly, we're made up of 12 operating divisions, which include 9 agencies in the U.S. Public Health Service and 3 human service agencies. This include the more popular agencies that many people are aware of, like the CDC, the FDA, I'm losing myself, there we go. The CDC, the FDA, the NIH, and maybe many of you are familiar with CMS. But there are also several agencies that many people do not know about and are less aware of. But for instance, we have the Substance Abuse and Mental Health Services Administration, or as we like to call them, SAMHSA, who lead the public health efforts to advance the behavioral health of healthcare of the nation. And you also have heard of the HRSA, or the Health Resources Service Administration. But did you know that they are the top grant-making operating divisions within the department, with over 90+ programs and 3,000 grantees, including our federally qualified health centers and the Public Health Service Commission Corps Loan Repayment Program. And then there's the Administration for Children and Families, or ACF, who promote the economic and social well-being of families, children, individuals, and communities through programs like the Community Service Block Grant and many other grant-making programs. And then there's the Administration for Strategic Partnership and Response, or ASPR, who leads the nation's medical and public health preparedness for, response to, and recovery from disasters, public health, and public health emergencies. And then there's the Agency for Healthcare Research and Quality, who produces evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable. And then there's the Administration for Community Living, or ACL, which support community-based organizations who work directly with older adults and aging population. And the Agency for Toxic Substances and Disease Registry, who work closely with the EPA in protecting communities from harmful health effects related to exposure to natural environment health threats. And finally, as if that's not enough, we also have the Indian Health Services, or IHS, who is responsible for providing federal health services for American Indian and Alaskan Native population. So, as you can see, these operating divisions administer a wide variety of health and human services and conduct life-saving research for the nation. Now, we also have several staff divisions, like my office that sits inside the immediate office of the Secretary, and also the Office of the Assistant Secretary of Health, who works with all of the state health departments. But I will not walk you through all of those divisions, and you can just read those on the screen there. So, under the leadership of Secretary Becerra, HHS prides itself in working collaboratively and working collectively to advance the public health priorities of this administration. So, I wanted to take this time to explain the different divisions within HHS and their mission so that you can better understand the many ways and opportunities we can connect with you and we can work together in helping to advance these priorities. So now we get to the fun stuff, right? So what is the administration's priorities? Well, when it comes to our priorities, we have 4 big buckets. As you can imagine, in a region like Region 4, which has 6 out of the 10 states, non-expansion states, our top priority remains expanding access to care. But despite those holdouts, this administration has continued to work hard to make affordable and make healthcare affordable and accessible to all Americans. Second, on a separate but related issue, we want to help reduce healthcare costs across the board. And third, we put a lot of focus on ending the mental health crisis in America, and thanks to our friend in Congress, HHS has been able to dedicate $247 million in resources to address this national crisis. And finally, we have also made substantial investments to address maternal health crisis in our country. And in response to the President's executive order, we look to advance equity within each one of these priorities and how we can affect change through health equity lens. So let's take a look at each of these priorities, and then I explain some of the administration's effort in addressing these individually. Under this administration, we've been able to expand access to care and build on the success of the Affordable Care Act. Today, the ACA is stronger than ever thanks to 13 years of diligent implementation efforts and the passage of bills like the American Rescue Plan and the Inflation Reduction Act. And as a result of these two bills, healthcare costs are at an historic low as a record high 16.4 million people signed up for coverage through the health insurance marketplace during the recent open enrollment. This includes 3.2 million Floridians, thanks to our Florida navigators and assisters. So when we look at the record enrollment through the marketplace, the continual coverage enrollment provisions in Medicaid, and several recent states expanding Medicaid, we have more Americans covered by some form of health care today than ever before. However, as I mentioned earlier, 4 states have not expanded Medicaid. Well, as I mentioned before, 4 states have expanded Medicaid over the last 2 years. But here in Region 4, we're still pushing an envelope in the 6 states within the region to make the case that Medicaid expansion saves lives. And this includes Florida. As many of you already know, Florida has 20% of the entire country's population who do not have health insurance but can stand to benefit from Medicaid expansion. And as a result of not expanding, the state loses $5.1 billion a year on federal matches. But I digress. And in addition to fighting for expanding access and health insurance, the administration has also made lowering healthcare costs for Americans a top priority. The Inflation Reduction Act is one of the most consequential healthcare laws since the ACA and is delivering lower prescription drug costs, making health insurance more affordable and making the economy work for the working family. A major provision of the major provisions in the law already are in effect, including free preventative vaccines for people with Medicare prescription drug coverage, including shingles and Tdap vaccines, $35 caps on each month's supply of covered insulin for Medicare Part D enrollees. And as I mentioned, the ACA subsidies remain in effect and more people will qualify for help purchasing affordable, high-quality health coverage this year in open enrollment. And finally, pharmaceutical manufacturers are now forced to pay rebates in Medicare if they increase their prices for certain drugs at a rate that exceeds the rate of inflation. And so moving on to maternal health, we recognize that there is a heart-wrenching maternal health crisis in this country. Currently, Black mothers suffer pregnancy-related deaths at a rate that is 3 times higher compared to white mothers, and this is unacceptable. These disparities persist regardless of education and income level, and we know that many of these deaths are preventable. At HHS, we're taking unprecedented actions to close such disparities and strengthen Black mother maternal mortality by expanding coverage, implementing new policies, and providing funding to ensure safer pregnancies and postpartum services for new parents and their babies. The President's 2023 budget provides HHS with even more resources to improve the health of our nation's moms. It invests over $470 million across HHS agencies to reduce maternal mortality and morbidity, and it also invests $86 million for the Office of Minority Health to focus on areas with high rates of adverse maternal health outcomes and areas with significant racial and ethnic disparities. Becoming a parent is among life's greatest milestones, and pregnancy and childbirth should be a dignified and safe experience for all. So moving right along, I know we're running short on time. Want to make sure that we talk about what we're doing around mental and behavioral health. Now, as it relates to mental health, SAMHSA has a bold vision for the future of this crisis care in our nation. This vision is built on the belief that everyone experiencing crisis should have someone to talk to, someone to respond to, and a safe place for help. The U.S. transitioned to 988 as a new way to reach 988 Suicide Crisis Lifeline, and is an important step toward achieving part of that vision, someone to talk to. We want everyone to know that there is hope, whether you're experiencing thoughts of suicide, mental health, or substance use crisis, or any other kind of emotional distress. There is compassionate support available through 988. And speaking of mental health, children and young people in this country are facing an unprecedented behavioral health crisis. Even before the pandemic, the number of young people in America diagnosed with anxiety and depression or other mental health condition was on the rise. But between 2016 and 2020, the number of children from ages 3 to 17 diagnosed with anxiety grew by 29%. And those with depression grew by 27%, according to the data from HRSA's National Survey on Children's Health. In 2020, suicide was the second leading cause of death for young people ages 10 to 14 and 25 to 34. And among the top 9 leading causes of death for people ages 10 to 64, according to a report by the CDC. HHS is responding to the current crisis by developing and expanding grant programs that address the mental health crisis needs of our children and youth, including school-based programs, and community-based and trauma-informed services for children, youth, and other families that meet them where they are. And finally, over the past 2 years, the Biden and Harris administration has effectively implemented the largest adult vaccination program in U.S. history. While COVID-19 is not over and it remains a public health priority, we have tools to effectively manage the virus. We're in a different place today, and we have 3 years to go. We have also worked hard over the past several months to ensure a smooth transition to unwind the public health emergency. We have come to this point in our fight against the virus because of historic investments and your efforts to help mitigate the worst impacts. One of the critical components of our response to COVID-19 has been ensuring that all Americans have an easy access to COVID-19 vaccines, free of charge, and that will continue. But because continuous Medicaid enrollment ended, and states can now end Medicaid coverage, and as many as 15 million Americans could lose coverage, a majority of whom are adult and children of color. We are also doing the work to ensure that we are prepared for the future public health crisis. So let's work together to do everything that we can to continue to support those who need it, and be ready if or when the next public health crisis presents itself. So that covers at a high priority only a few of the priorities that this administration has been working on. And I will leave by saying that the Biden and Harris administration is here to fight for you and with you. Our door is open, and we are ready to engage you and help advance any of these priorities. But most importantly, we are here to listen and to help support you in your efforts to advance health equity here in Florida. Thank you again, and I look forward to engaging in a thoughtful conference throughout. Thank you again.
Thank you so much, Director Tyson, for that and for giving us that overview. It is actually a little overwhelming when you see all the different agencies. I could not have named all of those HHS agencies, could you? I learned some new ones today. So I've spent most of my career with the CMS side of things, but there's so much more. Well, thank you so much. I was just going to do a little bit of discussion and follow up on some of those. Let's start with the Medicaid eligibility redeterminations where you ended. That's on everybody's mind. It has started here in Florida. What are you seeing that's really effective that you're seeing states do to help people make it through the redetermination process smoothly, if they're still eligible, and if they're not, to transfer to other coverages? Are there some best practices that you're seeing?
Great. Yeah, that is a great place to start, and thank you for that question because I think that is on top of mind for the administration. What we've seen is the best way that we are getting out there is by leveraging our community-based organizations. I know, given the scope of our region, there are 8 different plans in place to get the word out to all the Medicaid recipients, but I think the community organizations are the ones that play the most important role because they're the ones that are being able to translate what the state is how they're communicating with the Medicaid recipients, and also making sure that the enrollees themselves are informed. So one of the strategies that we've been employing out of our office is engaging with state and local elected officials, holding town halls, and making sure that the information that the state is sending to recipients, we're able to translate, because we know that some states are different, they communicate different, the language that they're saying are different, the policies are different. So we want to make sure that the community organizations are educated on it, and then kind of run a campaign of sorts of a ground game, making sure that we're knocking doors and we're identifying where the Medicaid recipients are, and making sure that they're getting the information.
Great, great. And I know here in Florida, we were talking with some of the managed care plans who are engaging their members and have been given some additional flexibilities to be able to reach out to their members if they are losing coverage to do that too. So that's another tool that we have here in Florida. So great. You also talked about mental health. I know that is a huge priority here in Florida of our governor and the First Lady, as well as many of the agencies. I think we've all had a revelation that mental health is critical to health overall, and that it's been really strained during the pandemic. So you mentioned several different pots of funding that maybe are available. Is that something that states can take advantage of, or community organizations or providers? How does the state get involved in those funding initiatives?
Absolutely. So there are millions upon millions of dollars that the federal government is dedicating toward mental health. For example, through the Safer Communities Act, as I mentioned, you have $247 million that are going to be dedicated and coming to the states and organizations through those pots of money. 185 of that will be through SAMHSA, and a lot of that is going to be focused on youth mental health and integrating mental health services into school systems, into other health provider models. But then there's also another 60 million that are that's going to come through HRSA, which will be funneled to organizations and to many of our HRSA grantees. Great thing about HRSA, they're in all of our communities. We have federally qualified health centers across the country. We have community health centers across the country. So anyone that is already kind of connected to the HRSA network will be able to get an additional bump and to be able to integrate mental health services into their already established health delivery model. Now, the issue is going to be making sure, because it makes sense to say, invest more money here and write more mental health professionals into your facilities. But then we want to make sure that we're going to have a lot of money invested in technical assistance, so that these facilities can have someone to talk to about best practices. So one of the things that we're doing now is having a lot of conversations and seeing where the best practices are, so that we can kind of share. And so my office, as we go into each state, we're listening to practitioners and seeing how they're addressing integration of mental and physical health. And then if it's something that is working, that is something that we're bringing up to the national level, and hopefully we can expand and spread the good news about what's working and what's not.
Great. I know a lot of our FQHC representatives are here, so maybe we can connect you up so you can talk with them. So
Absolutely.
I think we can do
Looking
that.
forward to it. Love to.
You spoke to something near and dear to my heart, maternal health outcomes. I know everyone is very concerned. We've got a great panel here and a lot of folks in this room working on that issue and trying to combat the disparities and make better outcomes for everybody. Can you tell us a little bit more about the kinds of things that the administration is working on in that area, and again, are there any best practices that are coming out that we should be sure to know about as we design our programs here?
So yeah, and this is one that's near and dear to my heart, to the administration's heart, because it's despicable to know that the birth of a child could result in the death of a mother, and that the rates are the way that they are in the most advanced country in the world. So what we've done, we have a lot of money invested in the CDC to find out the problem. We know that one of the problems are the social determinants of health, that a lot of times just because of the color of your skin, your odds go through the roof, that you would potentially die from a childbirth. But we also are investing money in understanding, okay, so why is that the case? So I know through the Office of the Assistant Secretary of Health, we're doing convenings, and they have a number of convening tools like the maternal mortality review committees, who are going through and researching hospitals' policies and making sure that we have stakeholders at the table speaking about and justifying the policies that they have, and the policies that don't exist, why don't they exist? So we are creating those spaces where we're actually talking about this from a statewide level. And then we have the prenatal quality collaborative, where it's very similar, but as a result of these conversations, we're able to rate hospitals' birthing outcomes. And so CMS has really been involved in working with the Assistant Secretary of Health on making sure that we have a correlation so that we can have public information and public knowledge about which hospitals are good with maternal mortality and which hospitals are not good. And so we want to make sure that that information is public, to make sure that healthcare providers are held to be more accountable to the services that they're providing to all mothers.
Great. Yeah, and I think,
on the money aspect, there again, another shout out to HRSA. HRSA, they are the ones that are getting the money out in the community. Through HRSA, they impact over 34 million people through their maternal and children health programs. So please reach out to us to learn more about what they have going on. They have many programs and millions of dollars that we're trying to get out into the community to help curb the maternal health crisis.
Great. And there are a lot of people in this room working on these issues, so I know would love to get you connected to them. There's a great panel. All the panels are great, so I'm just highlighting a few of them, I promise. But a lot of people with boots on the ground working on these issues as well. I know we only have a few minutes left. I wanted to ask you a little bit about workforce, since you most recently were working in really a different kind of capacity in the community level in Atlanta. Tell me a little bit about what you were doing there, because workforce is on everybody's mind, and we are trying to figure out how to get the right people with the right skills connected to the employers who desperately need those professionals.
Right. Thank you for that question. And I think this is one of the things that I love to bring into the healthcare space, especially after the pandemic. You know, every conversation that I have around any of the priorities, there's always this element about, okay, but what about workforce? Yes, great, you give us more money. Yeah, great, you have these different initiatives, but we don't have the people to execute and implement these initiatives. So we get it. So what I was in charge of when I was at the City of Atlanta is helping build pipelines using other federal dollars through WIOA, which is the Department of Labor grant, and helping get people connected to training and credentialing and potentially on someone's job through on-the-job training programs and combat working training programs and customized training programs. These are different training models to help make sure that people are either getting skilled up or to the point where they can gain a job or won't lose a job. And I feel like in this time now, that's a important skill set to bring into this space, because we saw an exodus of healthcare workers. So being able to build up that next generation of healthcare workers is not going to happen overnight. We have to focus on building a pipeline. Now, there are resources, again, through HRSA, common thread, through the National Public Health Commission Corps, where we can encourage students, college students, to go into medical school, and if they join the Commission Corps and serve 3 to 5 years in a distressed area or an underserved area, they have their medical, the education loans forgiven. Now let me ask, how many people have heard of the Commission Corps? And see, in this room, everybody should have had their hands raised, but that's nothing against you all. That's just a job that we have to do, better educating people about the resources that exist so that you all can be advocates for us. And so when you have the conversation of the next generation of healthcare workers, you know the resources that lie within HHS to say, hey, you may want to consider medical school because there's a way that you can go for free. And so we are keenly focused on helping build that pipeline. And I think the other point that I want to make to that, I personally charge our leadership in DC to make sure that we are looking into all of our agencies to see where those monies are so that we can start building the pipeline, because a lot of money sits on the vine in HHS that no one knows about. And so until we can communicate that and those resources and educate rooms like this, then, we have a lot that we can do on our end.
Yeah. Well, I think you've touched on maybe the last topic that I want to talk about, which federal government, huge, vast, a bit opaque, even to those of us who think we're in the know about such things. There's so much there. It can be pretty overwhelming. So how do you suggest that this audience of people dedicating their careers to healthcare and quality improvement, how do they keep up with key policy changes? How do they get involved and get their voices heard? Because we talked a little bit last night about how sometimes there's a disconnect between the federal policymakers and the administration and the people who are actually doing the work on the ground. And so sometimes things don't translate very well. So how do you get more input from the people who are really doing the work on the ground?
Well, first and foremost, reach out to our office. We can get you connected. So I left, you all have my information. So that is our office, the regional office in Atlanta is the gateway to HHS and everything HHS. So if you reach out to our office, we can make sure that we direct you into the right operating divisions to get your questions answered. And then, I can't speak too much to it, but engage your members of Congress. They're on the front lines of future policy decisions that are being considered in Congress. So having an open relationship and a relationship with your member of Congress is very important. But then also you can go to hhs.gov/regulation to see what regulations we're considering. That is really key, because that is a place where you can unadulteratedly provide comments to regulations that we're considering and be involved in our rulemaking activity so that we can hear about how existing policies impact the work that you do and any changes if it's significant or even minute, because what may be minute in DC may have an entirely different impact on the ground. And that is what goes into, that's the thought process that goes into us in the federal and in administration space. So you have, in the impact change in Congress, continue to communicate with your member of Congress. But if you want to really get involved with what's happening on the ground, go and comment on the regulations that we're considering. And last, get involved in your associations. A lot of you on a day-to-day, you're concerned about impacting and keeping your people healthy. That is what you get paid to do. If you're a doctor, you get paid to keep all of your patients healthy. You don't necessarily you're not being paid to get involved in the policy aspect of healthcare. So making sure that you're members of associations, and I'm assuming by you all being here, you understand the impact of that. But the agencies, those associations actually represent you all's interests in DC. And so when we have communication and engagements with agencies, we know that we're talking to millions of people at one time, and they are able to voice their policy positions to us in a very efficient manner.
Wonderful. Well, I think we are at the end of our time. I really wanted to thank you for being here and for representing the administration to this group and maybe making that connection a little bit closer and make HHS feel not quite so far away. But Director Tyson, it's been a pleasure, and join me in thanking Director Tyson.
Thank you for having me.